Cardiac catheterization. It is a very important procedure which is performed to identify cardiac diseases and interventionally to treat the cardiac diseases. So as a nurse, we have to be aware of pre, intra and post cardiac catheterization care. So what is the definition of cardiac catheterization? It is one of the invasive procedures used to visualize the heart chambers, valves and great vessels and even coronary arteries. Usually non-invasively we use echocardiogram, invasively we use a coronary angiogram or cardiac catheterization. What are the purpose of cardiac catheterization? There are plenty of purpose or uses or benefits of cardiac catheterization. They are to analyze chamber pressure, oxygen saturation, to measure the oxygen saturation in the blood of the ventricles or atrium, ventricular function, that is ejection fraction and how the pumping ability of the ventricular muscles, valvular insufficiency, to know the difficulties of the valves inside the heart chambers like mitral, tricuspid, pulmonary and aortic valve insufficiency, stenosis, regurgitations, septal defects. All these things can be visualized with the help of cardiac catheterization. To identify congenital abnormalities, and some of the abnormalities are even treated by cardiac catheterization. Myocardial infarction, to examine the coronary arteries and the patency of the coronary arteries and to identify myocardial infarction. The next is indications. Indications are both diagnostics as well as therapeutic. So what are the diagnostic indications of cardiac catheterization? Is any diseases like unstable angina, acute coronary syndrome, myocardial infarction, congenital defects, abnormal stress test. If that stress test is abnormal, if you are suspecting the patient with coronary artery disease, then of course we send the patient for cardiac catheterization. Planned valve surgeries where they electively do a coronary angiogram, and cardiogenic shock, patient with cardiogenic shock, to identify the cause, but you have to stabilize the patient, then you will take the patient for coronary angiogram. Ventricular arrhythmias, abnormal ventricular arrhythmias, if you suspect the patient has any cardiac abnormalities. So what are the therapeutic benefits? There are plenty of therapeutic benefits or interventional cardiology used nowadays. Cardiac catheterization. So percutaneous coronary angiogram and ballooning will be done therapeutically to treat the coronary artery disease. Percutaneous transluminal coronary angioplasty, where the ballooning as well as they insert a stent inside the coronary arteries. Valvuloplasty, that is correction of the valve and replacement of the valve. So even replacement of aortic valve is done through the cardiac catheterization method. What are the contraindications? There are plenty of contraindications as we are injecting contrast media through this coronary angiogram or cardiac catheterization. There are some contraindications listed here. Hypersensitivity to contrast medium. This is the first thing. That is, if the patient is having any allergic to contrast medium. Pregnancy, during pregnancy of course it is avoided. Severe systemic infections, if patient is reporting with fever and high WBC count, generally they don't prefer taking the patient for coronary angiogram. They have to reduce the WBC count, treat infection, then bring back the patient. Irreversible brain damage, severe heart failure patients, acute GI bleeding, because you will be administering lot of blood thinners before starting a cardiac catheterization. So GI bleeding cases, patient with acute GI bleeding, they are not supposed to undergo coronary angiogram or cardiac catheterization. Severe hypokalemia, you have to treat the potassium level and then take the patient for cardiac catheterization. INR more than 1.8, that is prothrombin time ratio is 1.8 more, then they have a high risk of bleeding, and you are giving lot of blood thinners like clopidogrel or aspirin prior to procedure. Acute renal failure patients, if the renal failure is acute, then you have to treat the renal failure, then take the patient to coronary angiogram, or immediately sometimes in emergencies they may take the patient to coronary angiogram and then send the patient for dialysis in case of chronic renal failure. The reason is you are injecting a dye and the dye is excreted through urine, and patient's kidney has to function better for this. Severe anemia, because you expect bleeding and hematoma in these cases, lot of bleeding happens in this procedure, so patient with anemia are not supposed to undergo. Uncooperative patients, because we are not going to give any anesthesia or anything like sedation. Much of the sedation is not happening here, so uncooperative patients is difficult to undergo cardiac catheterization. So these are all the contraindications listed. We will move on to types. So cardiac catheterization, as we all know, there is left and right side of the heart, and there are plenty of structures on the right side and structures on the left side. So that is the reason there are two types of cardiac catheterization, that is right heart catheterization and left heart catheterization. So when you want to approach the right side of the heart, you always prefer vein, because the major vein comes out of the right side, the superior vena cava and inferior vena cava. So you have to go through the vena cavas to visualize the right chambers, and you can visualize the pulmonary artery. So right side of the heart, like superior vena cava, right atrium, tricuspid valve, inferior vena cava, right ventricle and pulmonary artery. If you want to visualize any of these structures, you will go for an right heart catheterization. In the same case, left side of the heart, like if you want to visualize the aorta, the great vessel, and ascending aorta and the coronary arteries, because the coronary arteries comes out from the ascending aorta. If you want to visualize the left atrium and left ventricle and mitral valve, aortic valve, all these things, then you have to send the patient for a left heart catheterization. So coronary angiogram is in left heart catheterization, because you are visualizing coronary artery, so you have your approach is artery. Clear? Sites used in cardiac catheterization. As I said, if it is right side, we mostly focus or insert the catheter into the vein, and if it is a left heart catheterization, we usually insert the catheter into the arteries, because you are going to enter into aorta and come inside the left side of the heart. Here you will go from superior vena cava and you will go into the right atrium, right ventricle and pulmonary artery. So as per the purpose of the cardiac catheterization, you may select right or left. In some cases, they may do right and left heart catheterization to completely visualize the heart. So they will insert two catheters, one in the vein and the one in the artery. So the commonly used veins are femoral vein and antecubital vein. Okay, and here this is the femoral vein. And here in left heart catheterization, you will use brachial artery, radial artery and femoral artery. The red lines are arteries. Catheters used. There are different types of catheters used as per the shape of the visualizing places, okay, or the approach of the catheter. These are all the commonly used catheters, that is zones, amplats and Judkins. And there is one catheter which is used for the right heart catheterization, that is to measure the pulmonary artery wedge pressure or pulmonary artery pressure. This is the Swan Ganz catheter. So what is the main purpose of this? Here you can see the blue color thing, which is a balloon tipped catheter, which is used to measure the pulmonary wedge pressure. So here you can approach pulmonary artery, and you can wedge is the division where they enter into the lungs. So here if you measure the pressure, it gives the pulmonary artery wedge pressure, that is the pulmonary hypertension pressure. Patients, if you want to measure the pressure of the pulmonary arteries, this is the best way of measuring it. So Swan Ganz catheter, which is very popular right heart catheterization. Contrast agents used. There are different types of contrast agents available in the market now, and these are all the very popular ones. Sodium ditriozoate iohexol, ioversol, and ioxalate. So these all are iodine compound. So when you prepare a patient for cardiac catheterization or coronary angiogram, right or left, whatever it is, you have to check the doctor's order, informed consent with the witness, and lab test which includes CBC, because you have to check patient is anemic or WBC count is increased, ESR to know is there any systemic infections, renal function, and PT, INR, echo, X-ray, and infectious markers, and serological test, very importantly hepatitis, HCV, and in some cases they do even MRSA. Check for allergic to iodine and seafoods. This is very important here. You can ask the patient for seafood allergy, so you can identify if they have an allergic to iodine. Skin preparation to be done as per the site of the cardiac catheterization. Some doctors, they may use radial artery or brachial artery or femoral. Femoral is a very common site. IV cannulation has to be done on the left side because the doctors will be doing the procedure on the right side. Placement of ECG electrodes. Of course, when you monitoring, you can fix the electrodes and keep the patient ready. Check pedal pulse and mark it. So you have to mark the distal pulses. If the femoral artery is used, dorsalis pedis and posterior tibial pulses has to be checked and marked also for easy checking, because we'll be continuously checking in the intraoperative as well as post cardiac catheterization. So you can mark it with a marker pen. Monitor hemodynamic status and keep the patient NPO while you prepare for 6 to 8 hours. If creatinine is above 1.5, as we said, renal failure cases, you can start mild, then you can start on IV fluid pre and post operatively 6 hours. ECG should be taken. A 12 lead ECG is needed because post operatively or post cardiac catheterization you have to match and compare the ECG. Due medications as per the doctor's, due pre-medications as per the doctor's order should be started. As I said, there will be lot of blood thinners we need to give to make the blood very thin, because we are going to insert the catheter inside the stream of bloodstream. Aspirin, clopidogrel, and pantoprazole, and mild sedation should be given, diazepam. Empty the bladder before sending the patient to cath lab, because the patient needs post-operatively at some rest. Instruct the patient regarding procedure time and experience of hot flush during injection time. Some patient may have nausea and headache. You should inform them. Assess the patient to go and wear OT dress. Check implants and dentures has to be removed. Hand over the valuables and check document height and weight just to know the measure the dye or contrast media. How is the procedure done? Preparation as per the site, the type of catheterization, a fluoroscopic catheter is inserted into the vessel, and advancement of catheter is visualized with the X-ray fluoroscopic image. The images are recorded for evidence. Once the catheter is in position, measure the amount of contrast is injected. Nurse has to monitor the hemodynamical status, and advanced cardiac life support things has to be kept ready. Patient should be monitored for arrhythmias, and they will, what is the purpose of the catheter inserted, they will visualize the things, and during that time you have to monitor the pedal pulse for any poor perfusion of that extremity. Once the procedure is done, the catheter is removed and the pressure dressing is applied. This is very important because you expect a lot of bleeding from the artery and vein. Patient is shifted to the recovery. Post-procedure care includes bed rest for 6 hours, observe the catheter site for bleeding or hematoma, do a 12-lead ECG and compare it with the pre-catheterization ECG, check peripheral pulses, monitor hemodynamical status, warning, watch for complications, advise the patient to keep the affected leg straight. You can elevate 30 degrees to feed and advise them to drink a lot of fluids. If you want to repeat, you can repeat the labs. Complications: arrhythmias, thrombosis, pericardial tamponade, embolism, stroke, myocardial infarction, bleeding and hematoma and contrast reactions are expected. So you have to watch the patients for all these complications. Thank you for watching. See you in next video.